Okay, we really need to unpack this. We are diving straight into, what has to be one of the most high stakes, one of the most controversial public health decisions in a long time.
It really is.
This isn't just some minor policy tweak. We're talking about the CDC's Advisory Committee on Immunization Practices, ACIP, and a vote that basically reverses a core strategy that's been working for over 30 years.
That's exactly right. And our mission today is to really get into the core tension here, this recent 8-3 vote. They're withdrawing the universal recommendation for the hepatitis B, or Hep B, birth dose for babies whose moms test negative for the virus.
HBsAg negative, right?
Right. So we have to ask,
Yeah.
was this a smart move towards, medical flexibility? Or was it just a reckless threat to a massively successful public health program?
And the immediate outcome is huge. Instead of every newborn just getting the vaccine routinely, the new guidance is for individual-based decision-making.
Or shared clinical decision-making?
Right. So now it's basically a conversation, a choice, as long as the mother's test is negative.
It's a massive shift. And to really get how big a deal this is, we have to go back. We have to start with the history and what this universal recommendation actually accomplished.
Yeah, that context is so important. Why did ACIP even adopt this universal dose back in 1991?
Well, because what they were doing before was failing badly. The old strategy was a targeted, risk-based approach.
So only vaccinating babies of mothers they knew were carriers.
Exactly. But the system was just full of holes. You had incomplete prenatal screening, paperwork delays, and just failures to get the shot in on time. They realized they were missing way too many babies. The universal approach was just a practical fix for a broken system.
And the results were they were beyond what anyone expected, right?
Oh, absolutely. When you look at the raw numbers, it's staggering. We're talking about a 99% drop in annual hepatitis B infections for infants and kids.
99%?
Yeah, from something like 16,000 cases a year down to less than 20.
That's practically eradication.
It's as close as you can get. To put that in context for you, since 1991, this one simple policy has prevented over 6 million infections and nearly 1 million hospitalizations. It's hard to find any other public health program with results that clean.
And the stakes are just so high with this infection. It's not a cold.
No, not at all. This virus attacks the liver. It can lead to chronic disease, cirrhosis, liver failure, cancer, and death. And for infants, about 90% who get infected at birth develop a chronic infection.
And the tragic part of that statistic?
The tragic part is that a quarter of those kids with chronic infection will die prematurely from the disease.
I remember the sources brought up that huge Taiwan study, which really drives home the long-term cancer risk.
Yes, that was definitive. They looked at over 1,500 liver cancer patients over almost 30 years, and their conclusion was clear. Vaccinating babies against hepatitis B massively reduces their risk of getting liver cancer later on. This isn't just about preventing a sickness, it's a lifelong cancer prevention shot.
Okay, so you have a policy that all but wiped out a deadly childhood disease and prevents cancer. And the ACIP votes 8-3 to weaken it. So let's flip to the other side. What could possibly be the rationale for this change?
Right, so the new recommendation is this individual-based decision-making. Parents and doctors can talk about the risks, like, is there a family member with Hep B or contact with people from certain countries? And if they decide against the birth dose, the baby starts the series at 2 months instead.
And what was the core argument for that flexibility?
It really came down to 3 main points. The first was about risk. One proponent, Dr. Tracy Beth Haig, she argued that for most babies whose mothers test negative, it's an extremely low-risk situation.
So if the risk is tiny, why the immediate intervention?
That was the idea. The second point was that the U.S. is an outlier, that our universal birth dose policy is different from other developed countries with low Hep B rates.
But hold on, if other countries don't do it, what systems do they have that we might not?
And that is the billion-dollar question and what the critics immediately jumped on. Many of those countries have robust, universal health care. They have near-perfect screening and follow-up. We tried the targeted approach here, and it failed.
Okay, and the third argument?
This one was maybe the most controversial. Dr. Cynthia Nebeson argued that the birth dose's contribution to the decline in cases was likely small. She said it was really due to better blood screening, dialysis, things like that.
Wow. So the proponent's case is, it's low risk for most, we're an outlier, and the vaccine wasn't even the main driver of success.
In a nutshell, yes.
You can see why the medical establishment just exploded. Groups like the American Academy of Pediatrics, the AMA, They did not hold back.
Furious is a good word.
Yeah.
The language they used was, well, it was unprecedented. Reckless, irresponsible. I think one source even said purposely misleading guidance. They were certain this would lead to more infections and more deaths.
So what are the immediate practical risks they're worried about?
First and foremost, going back to a targeted approach means you need perfect screening, flawless. And we know our system isn't. An independent analysis found not all women get tested, records get lost, and you have false negatives.
So we're just recreating the exact same failure from before 1991.
Precisely. Dr. Amy Middleman warned that this will recreate the very disparities the universal policy was meant to fix. The people most at risk, those with poor prenatal care, for example, are the ones the old system missed and the universal system protected as a safety net.
And the idea that a mother's negative test makes everything safe, that's flawed too.
Totally flawed. A baby can get infected from a family member, a caregiver, anyone. The mother's negative test isn't a guarantee of safety. And then there's just the logistical mess. The AAP pointed out that shared decision-making is confusing and way more complicated than just a simple routine shot.
Okay, let's talk about the safety argument, because some of the new ACIP members were raising concerns that the vaccine could harm newborns.
Yeah, and experts like Dr. Meisner just firmly rejected that. The Hep B vaccine has one of the best safety records out there. It's been given millions and millions of times.
But the proponents also brought up this technical point about immunity waning over time.
They did. They claim that because antibody levels drop, the vaccine isn't working long-term. But Dr. Meisner explained that's a misunderstanding of how immunity works.
Antibodies are just part of the story.
Right. Think of antibodies as the soldiers on the front line. But the real defense is the very strong cellular component. That's like the permanent military base. That base provides lifelong immunity, even if the number of soldiers out front goes down. The idea that falling antibody levels means you're not protected was called just flat out incorrect.
So this goes beyond just the science then. We have to look at the process, how this vote even happened. The sources describe the meeting itself as chaos and confusion.
And this is really central to the whole story, because a few months before this vote, something extraordinary happened. The HHS Secretary, Robert F. Kennedy Jr., fired the entire 17-member panel.
The entire panel.
The whole thing. And replaced them with hand-picked advisors who critics say have ties to anti-vaccine groups.
That's a huge shakeup right before a vote like this. And then there were questions about who is presenting the data to this new committee.
That's maybe the most startling part. The presentations arguing for the policy change were given by non-vaccinologists. One was a climate scientist, Dr. Nevison, and another was an attorney and anti-vaccine activist, Mr. Blaxill.
An attorney.
An attorney, yes. And it was noted his co-authored paper on autism costs had been retracted just the year before. This is a huge break from the norm. A study found financial conflicts of interest on ACIP were at historic lows right before all these dismissals.
So you have a new committee presented with data from non-experts, and the actual meeting process was flawed.
Deeply flawed.
Yeah.
Dr. Jason Goldman from the American College of Physicians said the draft language kept changing at the last minute, wasn't even shown on the slides sometimes. He accused them of completely abandoning their own evidence-based framework.
The implication being that this was driven by ideology, not data.
That's exactly the implication. Dr. Goldman said the committee was making policy based on the concerns of individuals who want to refuse the vaccine. He just called the whole process completely inappropriate.
And just to make it even more chaotic, there was a second vote.
Oh, the secondary vote. Yeah, this is where it gets truly wild. It's Hess 641. It recommends that families talk to their doctor about getting a blood test, a titer, before the second dose to see if they even need it.
A titer, so that's just a test to measure the antibodies in the blood.
Right. They're looking for a level of 10 MIUML. The idea being, if the baby hits that number after one shot, maybe that's enough for now.
But we just established that antibody levels aren't the whole story.
Exactly. Dr. H. Cody Meisner called it kind of making things up. That blood test only shows the short-term response, the soldiers. It tells you nothing about the long-term cellular immunity, the military base. You need the full series to build that base reliably.
So forget the science for a second. The logistics of this are a nightmare.
A complete nightmare. Dr. James Campbell from the AAP laid it out. This would mean 3.5 million babies get one shot. Then they have to go get their blood drawn. Then they get a second shot. Then they need to get their blood drawn again.
You're replacing one simple shot at the hospital with a whole series of appointments and blood draws.
It's a massive burden on parents, on clinics, on the babies themselves. It just introduces so much complexity and so many chances for a child to fall off schedule.
So when we wrap this all up, the core conflict seems pretty clear.
It is. The ACIP vote is prioritizing this idea of parental autonomy and individualized choice over a proven population-wide strategy that protected everyone, especially the most vulnerable, from a really terrible disease.
It's a fundamental split on how you manage public health risk. The argument for choice sounds good, but the cost is you lose the safety net that caught all the cases the old targeted system was guaranteed to miss.
And we should be clear, this isn't official policy yet. It still needs final approval from the CDC's acting director. Until then, groups like the AAP are just telling everyone to stick with the universal birth dose schedule that we know works.
So when you really look at this whole thing, the question for you, listening to this, becomes very clear.
Yeah, this new system of shared clinical decision-making will be covered by insurance. But for you as a parent, you have to ask yourself, does having more flexibility, this extra conversation in a busy hospital, does that really outweigh decades of public health success that relied on zero tolerance for missed opportunities?
That's the real consequence here. It's the choice between a conversation and a certainty.